Hello and welcome to today's ISNTD Connect webinar. I'm Marianne Compred and I'm speaking from the International Society for Neglected Tropical Diseases. And today we are marking World Sight Day, which for the last 20 years has been a hugely important global event, putting the spotlight on blindness and vision impairment. Currently, more than 1 billion people still cannot see well, and unbelievably, about 3/4 of those cases are avoidable and preventable. It often surprises people, probably not in this audience, that a disease called trachoma is the leading infectious cause of blindness worldwide, and currently trachoma is still responsible for the blindness of about 2 million people worldwide, and over 130 million people remain at risk in trachoma endemic areas. So a hugely important problem for the NTD community. And although these figures do remain very sobering, it's important to note that there's been a tremendous amount of progress in reducing the burden of trachoma in the last 20 years. And those suffering from trachoma and at risk of trachoma, the number has dropped by 90% since 2002. So some cause for celebration. The last couple of years have also been really encouraging in this field, with the World Health Organization releasing a World Report on Blindness last year, and hugely importantly this year, political will and commitment being really galvanized by the adoption of a World Health Assembly resolution calling for member states to put eye health really at the core of universal health coverage. So in the light of this very important and pressing issue, and given World Sight Day today, it's been our huge pleasure and very important for us today to welcome two colleagues from the International Coalition for Trachoma Control. The successes I mentioned above can only really be the fruit of global and multi-sectoral collaborations, and so we're delighted to have today both Angelia and Aparna representing the ICTC, which is a coalition bringing together a vast amount of organizations, NGOs, donor organizations, private sector, academia, and so forth. So first and foremost, a very warm welcome to our two speakers today. Angelia Sanders, you're Vice Chair at ICTC, and also you are Associate Director of Trachoma Control Program at the Carter Centre. So a very warm hello and welcome to you, Angelia. Hi. And also Aparna Barua Adams, you're Project Manager at the ICTC, and it's also our greatest pleasure to welcome you today. So a very warm hello from us all today.
Thank you very much for the introductions, Marianne.
Brilliant. I think our audience is also tuning in and saying hello. We've got Emmanuel from Nigeria, Stephen from Canada, Maddie from Iran, so very international audience for you today. Without any further ado, I'm going to hand over to Angelia and Aparna to tell us a little bit more about trachoma control on this World Sight Day. The tagline for this year is Hope in Sight, and I think the work that you have been doing and also the future in this field really ties in very well with that theme. So over to you, and a very warm welcome to our ISNTD Connect today.
Thank you so much, Marianne, and wonderful to take part today in today's discussion. We really hope that today's reflections and thoughts around the progress that we've seen around the global trachoma program will really help to stimulate some questions and conversation around how we can collectively work not just with the broader NTD community, but also with the eye health sector in being able to collectively support national health systems. As many of you may be aware, for a long time, blinding diseases like onchocerciasis and trachoma were part of the portfolio of work of national eye health units. And as the coined term for neglected tropical diseases started to grow as a health portfolio in its own right, it meant that for the last 20 years almost, trachoma and onchocerciasis have been pulled out of their traditional relationships with the eye health sector in with the neglected tropical diseases, really in order to accelerate efforts to tackle both of these diseases. From the perspective of trachoma, the closer we reach global elimination efforts, and we are seeing an increasing number of countries be validated for elimination, we recognize that for the impacts of those programs to be sustained, a reintegration of trachoma interventions into eye health communities and the eye health sector is really what will help to solidify the sustainability and resiliency of health systems. So today's presentation is about sharing some of those lessons we've learned from the trachoma community, sharing some of the challenges we continue to work with in order to reach global elimination efforts, and also some ideas for how we can better work with the broader NTD sector and the eye health sector to really sustain some of that momentum. So I'm going to hand over to Angelia for the start of our presentation.
All right. Okay, welcome. Good morning and good afternoon, and maybe even some good evenings out there. We're the ICTC, especially Aparna and I, are very happy that you are joining us to celebrate World Sight Day by learning about a very preventable disease that has really both done a lot of damage, but that we have a lot of successes to celebrate. So just to provide a little bit of background for some of you that may not know much about trachoma, and again, one of the reasons that we like talking about trachoma on World Sight Day is because it is still the leading infectious cause of blindness. It is caused by infection from the bacterium Chlamydia trachomatis, and it is passed from person to person by infected eye secretions where there is poor sanitation and hygiene, which is usually due to limited access to water. It's spread through contact with eye discharge from an infected person, usually through hands, towels, sheets, and in some cases, eye-seeking flies that will move between people's faces. And again, a lot of times this is connected to areas where there's poor sanitation and limited access to water and personal hygiene. Repeated infection can result in scarring on the inside of the eyelid. And what that does is that the scarring causes the eyelid to start to turn inwards so that the eyelashes touch the cornea. And what happens is every time you blink, it cuts the eye. And we all have had the experience of one eyelash being in our eye. We can't focus until we get that one eyelash out. So you can imagine if many of your eyelashes are just touching your eye every time you blink. And eventually this can lead to blindness. And once a person becomes visually impaired or blind, we cannot reverse that effect. Trachoma is currently estimated to be responsible for visual impairment of about 2.2 million people, 1.2 of which are already irreversibly blind. So what do we do in order to prevent it and treat it? We use the SAFE strategy. And we have some pictures at the bottom of this slide. Surgery in order to correct the eyelashes, bringing the eyelashes and focusing them out, or to correct the eyelid, bringing the eyelashes out. Antibiotics in community-wide mass distributions. Facial cleanliness to remove the nasal and ocular discharge that attracts the flies and also passes the bacteria. And then environmental improvement through access to water, building and using of latrines, and keeping compounds clean. Since 2012, the Global Trachoma Program has significantly scaled up a truly global trachoma elimination program. And because of these efforts of so many different partners, governments, representatives from the World Health Organization, we were very pleased last year to celebrate that 152 districts around the world reached active trachoma elimination thresholds. And what that means is that those districts, this resulted in 21.8 million people no longer needing drugs. If some of you are like me, I love maps. I feel like they give just such a visual, sort of instant understanding about what we're dealing with. And this is one of the most important things. How do you tackle a disease if you don't know where it is and how bad it is? How do you mobilize resources if you don't know what you're dealing with? And I think this is very much a very big success of the Global Trachoma program. Through the Global Trachoma Mapping Project, the goal was to complete baseline mapping in trachoma and endemic areas by the end of 2015. This was an initiative that was funded by DFID, USAID, and multiple other partners. And ultimately, they were able to conduct these baseline maps in 29 countries, examining 2.6 million people over a four to 5 year period. That generated 53 million pieces of data that was able to help countries plan their activities. It was also used to inform 2 partnership initiatives, the Queen Elizabeth Diamond Jubilee Trust, and also the DFID SAFE project. And that funding was about 80 million British pounds, reaching 13 countries in order to implement the SAFE strategy in hundreds of districts. And that mobilization of resources would not have been possible to the scale that it was without all of this data that was generated to show the overwhelming need. And we didn't just stop with the Trachoma Mapping Project. It's continued with tropical data, which since 2016 has supported national programs to conduct almost 2,000 surveys across 43 countries. And that translates to 6.1 million people who have had their eyelids flipped or examined in order to know where we are with trachoma. And we now know where we are is really great. There's been a 91% reduction in the number of people at risk of trachoma since 2002. And most of that, 57%, has been just within the last 10 years. 662 million doses of antibiotics have been distributed since 2011 in order to clear infection, and 1.46 million surgeries have been conducted by national surgeons in their countries in order to treat the blinding stage of trachoma. So we're moving in the right direction. Our map is changing colors from where it was before as we start to move towards our elimination targets. And that has been done through a lot of very important partnerships, which Aparna is going to be discussing next.
Great, thank you, Angelia. So you'll have noticed that Angelia has referred to a global trachoma program, and that's really a reflection of how the trachoma community sees itself contributing all of our various efforts across the variety of trachoma implementing partners, the contribution of endemic country health ministries, the private sector, the philanthropic sector, research and academia. And it's really this collective sense of community that is helping us to identify and support really a global trachoma program. So that's what we're referring to when you hear us talking about it. And as Angelia mentioned, partnerships really have been one of the key factors of success for the progress that's been highlighted to date. And partnerships take place in all sorts of styles and forums and mechanisms. And I guess I wanted to use this opportunity to really highlight 2 particular partnerships. So one is the WHO Alliance for the Global Elimination of Trachoma, and the second one is around the International Coalition for Trachoma Control. So in 1993, WHO endorsed the SAFE strategy as the main or the key approach for the control and elimination of trachoma. And in 1996, WHO launched the Alliance for the Global Elimination of Trachoma. And the Global Alliance is a really big partnership of 5 main constituencies across endemic countries, NGOs, academia, research, and donors, all of whom are working together to support country implementation of the SAFE strategy, and really work together to strengthen national capacity through support for epidemiological assessment, monitoring, surveillance, project evaluation, and resource mobilization. Now, with all the scale-up efforts to be able to roll out the full SAFE strategy across the 3 different interventions, the idea of the International Coalition for Trachoma Control became established in 2004, really with the premise of bringing together NGO implementers to work on a coordinated and collaborative approach to support national programs. And ICTC over the last 15, 16 years or so has really grown into a multi-stakeholder coalition where members are NGO implementing partners working together to support the Alliance for the Global Elimination of Trachoma. And the work that ICTC does is very much in terms of analyzing the Trachoma Global Program to understand where we can advocate for the elimination of trachoma as a public health problem, but through the implementation of the SAFE strategy. And ICTC really acts as a forum for collaboration, being able to share our learnings from across implementing partners, across health ministries, and to be able to coordinate how we're able to work together as implementing partners to support national programs. And in 2020, ICTC now holds a multi-stakeholder membership of over 50 NGOs and a range of observers across donor entities, academic institutions, and the private sector. And we continue to be focused in supporting the scale-up of the SAFE strategy to reach elimination. Through this work, we're identifying new areas for capacity strengthening, opportunities for new funding, but also identifying where remaining gaps in the global program remain. Sorry, bear with me one moment. Moving on to our next slide. So when we look at some of our key learnings from scaling up of the Global Trachoma Program, we're really looking at a few key things. And it's things that we hope will be lessons that we can share between multiple NTD programs as well. So some of the lessons we've touched on or learned from is things to do with the planning at scale and understanding that when we are planning programs for scale-up initiatives, it's not business as usual. And it does require a reframing of the narrative so that we are considering exit strategies as an integral part of our elimination programs and being able to factor in how we transition from elimination into routine public services. Secondly, we come to standardization and how this supports the implementation of scale and speed. With ICTC, the members and observers work together to really pool information on preferred practices. And this is all about using the information we're generating from implementation activities to really understand what are the best ways of implementing WHO guidelines. What is the best processes or how-tos that help to standardize not only the same approach that is used for training of community health workers, drug distributors, surgeons, for instance, but how do we use these preferred practices to standardize high quality delivery of interventions as well? Then we also have learned lessons from methodologies, looking at how we communicate around the methodologies that are being brought together, being tested, and how we understand how well they work. And you'll see a number of these methodologies, particularly for things like the Global Trachoma Mapping Project, are now being published as well. And we'll be happy to share some links for those publications to learn more about some of those methodologies for data collection. Then also using those preferred practices to look at robust training. And we understand these to be an essential component of scale-up initiatives because really being able to train community health workers, broader health workers, surgeons to be able to monitor and deliver high quality services is really essential. Then ensuring accessible data, really making sure that information is ready to inform national programs. So as Angelia mentioned, after the global trachoma mapping project, those methodologies were used to establish a new survey tool called Tropical Data. And Tropical Data is an end-to-end survey process that is supporting health ministries to collect data across trachoma. But it also has the scope to be able to be used for other NTDs as well, but also to look at indicators for cross-sectoral collaborations, whether for WASH indicators or whether for other approaches like the One Health approach. So tools like Tropical Data, using methodologies from the Global Trachoma Mapping Project, are really helping us to figure out how we make sure that the data continues to be country-owned, but also accessible. And then we're also looking at the implementation component of where WHO and NGOs are supporting many health ministries to continue the rollout of the SAFE strategy, with collaboration being key to that success, and understanding how and where best we can coordinate with different sectors across WASH, eye health, and education. And all of this is underpinned by a focus on quality and sustainability, which is essential for as we reach the last mile of communities. So this all leads us on to our next scope of opportunities, really around the World Report on Vision, which you will have heard mentioned earlier in today's session. And the World Report on Vision, which is a report developed by WHO, really builds on some historical work from another WHO initiative known as Vision 2020. And Vision 2020 was a global initiative launched in 1999 to eliminate the major causes of avoidable blindness as a public health problem by 2020. Now, the World Report on Vision really works to track progress achieved to date across these issues, but it also identifies remaining eye health issues and challenges that need to be addressed, with the purpose of how these work towards the 2030 Sustainable Development Goal, particularly Goal 3.8, that focuses on universal health coverage. Now, we know that globally, more than 2 billion people have vision impairment, and of that 2 billion, at least 1 billion people have vision impairment that could have been prevented or has yet to be treated. And that includes 2.5 million people with trachomatis trachiasis, the late blinding stage of trachoma. Now, the report uses analysis and modeling to be able to articulate that we expect the global demand for eye care as a whole is set to triple by 2050. And this is due to a range of factors, including population growth, aging, changes in lifestyle, but it also takes into consideration potential health crises that impact on resiliency of health systems to be able to manage these conditions. And it's important for us to recognize that when we look at the burden of eye conditions and vision impairment, that often the populations that they most affect will be people living in rural areas, people living with low income, women, older people, people with disabilities, those living amongst ethnic communities, as well as indigenous populations. And we find a distinct overlap in communities that also are at risk or carry an NTD burden within these particular groups. We also know that eye care services currently are still poorly integrated into national health systems as a whole. And this presents challenges for the availability, accessibility, and acceptability of eye care services, and have an influence on eye conditions and visual impairment for diseases like trachoma and onchocerciasis. For example, in many countries, particularly in low and middle income environments, eye care needs are still greater in rural areas, but services are often provided in hospitals in urban areas. Now, the report makes a series of recommendations using an integrated people-centered eye care approach to provide a continuum of promotive, preventative, treatment, and rehabilitative interventions against a whole spectrum of eye conditions, including trachoma and onchocerciasis. And this approach really encourages WHO member states to adopt 4 key strategies in order to deliver this approach. The first one is to be able to engage and empower people and communities. Secondly, to reorient the model of care based on strong primary care. Thirdly, to coordinate services within and across sectors, so including across the eye health community, as well as the NTD community, as well as other cross-sectoral collaborations. Fourthly, to create an enabling environment, specifically the inclusion of eye care in systems and the planning of eye care workforce according to population needs. Now, the recommendations made in this report really provide a number of opportunities for the global trachoma community and other eye health communities to contribute to a broader global health agenda that will ultimately strengthen health systems so that countries are able to overcome challenges in meeting the current and projected eye care needs of the world's population, but also to support the resiliency of health systems so that countries are in a better position to weather future health crises during the current COVID-19 pandemic and beyond. So alongside articulating some of these opportunities for cross-sectoral collaboration, acknowledging the progress that has been achieved to date, and some of the partnerships that have helped to bring this about, we also need to discuss the importance of research and also being able to identify research priorities. So recognizing that particularly in this current environment under COVID-19, we recognize that this will follow this, this will also lead to anticipated global economic and financial crisis, and the way in which many of us will have to adapt to still continuing to do more, but with less financial resources. We also recognize that we need to continue to reassess vital operational research questions. And these are very much questions that will help to accelerate our progress towards achieving global elimination targets for trachoma. Now, the following research priorities that you see on your screen are just the top 5 priorities that were identified through a WHO coordinated discussion in 2017. And this research priority list is due to be revised and updated through a series of conversations that will be taking place this year through core NTDs as well. And it's important to highlight that these 5 questions aren't an exhaustive list of research priorities, but are the 5 key ones that will help us to navigate elimination, and particularly in line with the WHO NTD roadmap. It's really important to recognize also that the conversations that have contributed to the identification of these research priorities was really around seeking consolidated global trachoma community feedback and thinking around a harmonized list of trachoma research and defining the key game changers that will enable the achievement of global elimination. Now, the first 4 of these priority questions around approaches for F&E components, so facial cleanliness and environmental changes, around identifying specific population subsets, so particularly indigenous communities, nomadic mobile populations, populations at specific risk of fragility due to conflict, for example, and then looking at the major routes of transmission and surgery for trichiasis and maximizing post-surgical outcomes. These 4 questions identified have already been addressed in some way through current research portfolios. But we realize that limited funding continues to be the biggest obstacle to addressing these prioritized research areas and the growing number of identified gaps that the trachoma community with the research community are continuing to identify. So we have a short video to show you, which helps to kind of bring together some of these reflections on some of these challenges, as well as some of the opportunities for the global trachoma program to be able to focus in on.
Trachoma is an infectious eye disease. That person is in agony all the time until you are relieved by surgery. This center at the moment is doing trachomatous tracheasis surgery camp that we started 3 days ago. In a health facility, you may not get enough rooms and enough space. We resort to using any building that is around, and we can clean it and start to make our own theater. At the end, we were availed with this one here. We came, the whole thing was a mess. We had to do 2 days cleaning, disinfecting for 2 days before it was starting. So it's really a challenge to us. We have electric autoclave, but it cannot work here because there is no electricity. So as now we are using the one that uses charcoal. We have to improvise a number of things to make the work go on. We have a lot of challenges in terms of mobility. Some areas are hard to reach. The war between the rivaling groups, it makes our movement so difficult and we cannot cross from one area to another. We find it actually very difficult, but we have to do it because the service there needs us. In the community there, we also have challenges. Some communities do not understand the importance of this surgery. We have those rumors in the communities that these people are coming to remove people's eyes and so on. For them, they may believe it was by God that they go blind. They don't know that some people can help them somewhere. But when they come, they see the first people who will be discharged, they will not really disturb. We have assistants in the field, and even in the theater, you will find some people are assisting us. And these are not people who are trained somewhere, but we are not training them here locally to help us. So we are very few in the country. It leads to irreversible blindness. Since we are few, I have to do what I can do to help my people. It worries me because the workload alone is overwhelming me. We are going to operate you and you are going to be okay. Though there are some mild pain, but with time, they will be fine. And they will really feel the difference. We have a lot of patients that we operated, and most of our patients are doing well. And later when you visit them in their places, when you are doing follow-up, they will be very happy, greeting us. They are very cheerful. Whenever the community appreciates our program, we feel happy. We don't do it actually because we are gaining out of it, but we feel it is our role. It was my call to do so. Together with the team, we were able to make the place a better place for helping the needy. It makes me happy and very proud because these are the very people I'm supposed to help.
Okay, I always like that video, but I have lived in South Sudan for a few years, so it always makes me happy when I just see how well the program is doing, and it kind of relates to this next topic about what are the challenges for trachoma, the neglected tropical disease, and the eye care sectors as we move forward in order to continue the progress that we've already started. And the biggest thing is we have to learn from our own experiences and also the experiences of other diseases and organizations and coalitions. And some of those things include how important multi-sectoral engagement is, particularly focusing on the water, sanitation, and hygiene aspects, disability, inclusion, education, and the nutrition sectors. And the marriage of hard science, what we know, and using that for advocacy at the very beginning. We will also need to decide, how do we reframe the narrative about this final push? You know, for trachoma, we were aiming for 2020. Well, we are in 2020, and we haven't exactly reached all of our targets, though some countries have. And we feel we're in the final mile. So as we begin to move from a control program to elimination as a public health problem, it's about looking at extending the health and development narrative beyond our own specific disease focus, so beyond just trachoma, but other issues of sustainability, ongoing surveillance mechanisms, and most importantly, health systems strengthening. We also need to look at developing and engaging and empowering a new generation of leaders in the NTD community in all countries. And I'm very excited. I was making a list as you were introducing yourselves. We have people from Iran, Nigeria, Kenya, Uganda, Canada, UK, and I'm sure there's many others that are out there. And it's just very encouraging to see this world support for helping our fellow humans. And bringing up those leaders is one of those tasks that we need to continue to invest in. And then also bringing together the hard science and research. So what is the evidence that is out there? What is the evidence we don't have that we need to know to help us be more effective? And Aparna kind of discussed some of those research questions that are currently there, but there's always going to continue to be more questions. But when there's questions, when it looks at research, how do we leverage resources in order to pay for that research? And so that's something that ICTC is looking at. How do we leverage resources to use all the data that we have? There's so much data that has been collected on a multitude of indicators through GTMP and tropical data and individual NGOs that have conducted surveys and research. How do we take that, learn from it, and put it out there so that other people can learn? And then most importantly is ensuring that we leave no one behind. We have to look at the communities that are the most difficult to reach, the most expensive to reach, because this is a global program and we are not successful unless we're all successful. So how do we take what we're working on with trachoma and look at other issues that lead to trachoma, such as poverty alleviation? Also looking at topics like cross-border issues, when you have communities that cross between Uganda and Kenya because they're following their cows. How do we need to adapt our programs to make sure that those people are also reached? And then also insecure countries. We just had a video from South Sudan. How do we ensure that people who are being impacted by insecurity or humanitarian emergencies because of excess flooding or the locust issue, how do we make sure that they also don't lose out on access to health? And lastly, in summary, the big thing is we know where the disease is. We know how to treat it. We have people who want to make a difference. We have those committed stakeholders. We have the evidence on what we need to do. And what we're really excited about is that we have a roadmap. So we have a plan. Based off everything we know, we have a plan. And the World Health Organization NTD roadmap will cover the next 10 years. Hopefully it'll be launched the beginning of next year. And it will address some of those challenges that are not only affecting trachoma, but other NTDs, especially when we look at how do we adapt our challenges in the context of COVID, which Aparna also addressed. And we have to think about, in a world where we will have to achieve more for less, we really need to work together towards our common goals, such as the Sustainable Development Goals and universal health care. The roadmap helps give the NTD community a blueprint in which to do this and an opportunity to show how NTDs can support other sectors, not just our own goals, but a lot of these other sectors that very much overlap with the diseases that we work on. And then we also have the WHO World Report on Vision, which Aparna discussed. And it's important to look at how the recommendations within the report can provide opportunities for the global trachoma community and other eye health communities to contribute to sort of this broader global ambition. So everything is there. And I think on World Sight Day, this is just a great example of getting excited about something, getting excited about the successes that have happened, getting excited about where we're moving, and just knowing that millions of people are no longer at risk of this disease. And that means grandmothers are not having to worry about not being able to see the faces of their grandchildren, and that mothers don't have to worry about pulling their children out of school to help take care of them because they can't see and they need their assistance. This is about people, and we're making progress. So this is a good day to celebrate. And that will lead us to questions.
Wow. Thank you so much, Angelia and Aparna. That was an incredible presentation. Lots of our attendees are also saying kudos on your efforts. Very nice presentation. And we absolutely wholeheartedly embrace that feedback. I think it's worth just to remind everyone that the ICTC is a coalition of over 60 incredibly diverse organizations and partners, and perhaps including those in endemic countries. It comes down to managing about 100 organizations, entities or more. So a huge testament to your skills in leadership and really coordinating all that, all the way from the data across the board to community involvement and advocacy and so forth. So we can't reiterate it enough on World Sight Day. Absolutely, it's really wonderful to be reminded of the huge amount of work and the success and the whole journey. So thank you so much for that. And I think we also all really appreciated how you very clearly outlined next steps, perhaps some of the gaps remaining, and narrowing down really what those challenges will be. So thank you really once again very much for that. You've obviously generated a lot of food for thought here, and we've had quite a few questions coming in from our attendees. So first and foremost, I think one thing that struck out from your presentation was the role of governments in endemic countries, as reinforced in, as you mentioned, the NTD roadmap going forward. And also in endemic countries, not just local governments, but also local communities. And so we had a couple questions here. I know you did highlight it as a challenge, but perhaps you've already had some experience or some comments about how will you go ahead in this last mile to really galvanize the affected communities to take part in the whole process of controlling trachoma and reducing the transmission. Have you found certain things to work to really involve local communities?
I can take this. Yes, I absolutely agree. At the end of the day, each program is the national program. So it is the Uganda trachoma program. It's the South Sudan trachoma program. It is not the ICTC program. It's not the Carter Centre program or Sight Savers. And I think when you go in, when you have that ownership and that passion, it always helps the program move further along. And so, and it relates to kind of building up the NTD the NTD leaders within the NTD space, especially at the country level, but not just at the national. There have been times I've gone to the county or the sort of sub-district, and you just have some very passionate people, from the village distributor who gets up very early in the morning in order to distribute drugs, to a TT surgeon that has had to walk up a mountain in order to provide services because the community lives on the top, not at the bottom. And finding ways to engage them, sort of acknowledge their efforts is really, really important. And I think as we move forward, there's going to be an increased focus on how do you create more ownership, and especially when it comes to sort of financing within the country. I think a lot of people are worried that with COVID, how will that impact sort of the financing that is out there? And I think it's making us look a lot harder at where can we have cost efficiencies, where can the government sort of provide support and be less reliant on sort of that external, sometimes unreliable support.
And just to add to that, I think certainly from the Trachoma perspective, having such a clear strategy that is WHO endorsed for control and elimination has meant that we've been able to really focus on a multi-pronged approach across distribution of antibiotics, across coordinating wash components, across surgery. But it has also medicalized quite a lot of, the way in which the global stakeholders deliver the program. And I think that when we look at some of the recommendations from the World Report on Vision, particularly on integrated people-centered approaches, that gives us an opportunity, certainly from the Trachoma side, to really take on some of the lessons learned from other communities that take on a much bigger role in engaging affected communities directly. So, how do we learn lessons from other communities like leprosy, like lymphatic filariasis, on their work on rehabilitation, on disability inclusion, on directly consulting and working with affected populations and communities to be able to roll out and scale up these interventions with community support and buy-in. So I think, there are gaps that we recognize we don't do a lot of, and we're actively ready to take on the lessons from other communities who have done more of this.
Mm-hmm.
That's really interesting, and definitely there's one thing that ICTC has been incredible at is reaching out to all those different sectors, whether it be within disability or within WASH and so forth. So that's really wonderful. You were mentioning, Angelia and Aparna, not just the communities, but also the governments. And so that kind of overlaps with a question here from John Gibb, who was wondering, in terms of the governments involved, what has been the response in terms of ensuring that progress is sustainable? Let's leave COVID aside for a moment. So perhaps pre-COVID, how much have governments up to now really embraced these programs? And John Gibbs adding, this means Ministry of Finance as much as Ministry of Health. And we can come back to COVID in a moment because there's been more than one question, understandably.
It's, certain countries, each country is different. And I think sometimes some of the challenge is no matter where you are in the world, or whether you're a business or an NGO or a government, it's about the personality in power and the decision maker. So sometimes you can have this very passionate person who feels that this topic is very important, and you can make a lot of progress and they ensure that there's investment, but then that person, usually the ones that are the best are the ones that everyone wants to be part of their program, and then they get promoted. So I find that a lot of times it's the people that you have a lot of success with end up getting promoted to something else. And so it requires diligence and being aware of when there's changes and how you need to do advocacy in order to ensure the successes in the past are carried over to this new position, this new person, in their positions. And I know, for example, in Sudan, which is where the Carter Center works, the former Sudanese government actively invested in the Onco and Trachoma program, and they provided direct funding for programs to be implemented. And they were sort of early on amongst other countries to really do that kind of investment. And I think also it's important to, when we think about health systems strengthening and kind of moving away from vertical programs, it's not just about doing advocacy for them to fund trachoma, but to fund eye care, doing more clinics that enable eye care professionals that know how to do trachoma surgeries to be in more remote locations. So it's really kind of getting that infrastructure spread out into the communities so that more people are reached. And you can only do that when you have government involvement, both for the medical side of services, but also for the water and sanitation side of it, which is ultimately what's going to create that long-term stability, sustainability.
And I think many of us within the NTD community are really, what's the best way? I think the new draft WHO NTD roadmap for 21 to 2030 really puts into place some very important shifts that the NTD community needs to understand and adopt. And there is a lot of emphasis around governance, accountability, transparency, but it's also about understanding who is accountable, who holds the governance structure, how do we each participate to support them, to strengthen them, to uphold them. And I think there's a lot in this new WHO roadmap that is to empower endemic countries, but also inspire NTD stakeholders to reach out to more than your usual suspects. For so long, we have been used as a community to very vertical disease programs because often that has been historically how we've accessed financing. So now with this new roadmap and this new drive and push for cross-sectoral collaboration to maximize the impact of NTD interventions, NTD stakeholders themselves are being, really inspired to not just reach out to your NTD team within the health ministry, reach out to those working in WASH, to those working in veterinary public health, to the finance ministry. And I think we need to recognize the role that we all play, whether as researchers, academia, or implementers, that in order for us to support the benefit to communities, we need to move out of our disease silos. The roadmap really puts forward a very strong case for integration, not just between NTDs, but between sectors. And that can only happen with the support of all partners and stakeholders working with endemic health ministries.
Absolutely. And so going back to the inescapable COVID and building on what you were just both saying, you've mentioned the challenges, of course, but do you think there could be a slight shift given the emphasis on WASH practices and the overlaps with some of the aspects of the SAFE strategy? Do you think that COVID could be only negatively impacting on trachoma programs, or has that slightly shifted maybe the narrative within governments in endemic countries?
So Angelia, perhaps I might start off with more of a high level view and then hand over for some more trachoma deepest perspective. I think COVID, certainly within the trachoma community, the way in which we are not only following COVID-19, but also analyzing its impact is really coming to an understanding that COVID-19 will have short, medium, and long-term impacts, not just specifically on NTD programs themselves, but on health systems as a whole. And so right now we are battling COVID-19, but ultimately what we are looking to do is to support health systems so that they can manage the new operating environment that COVID-19 is presenting all of us with, but also to build their resiliency so that they can weather future health crises in the future. So I think what we're seeing, not just across trachoma, but across multiple health issues, is a whole new operating environment for health systems. And recognizing some of the impacts that it is having on programs like Trachoma, how does this change our modeling to understand where we are in the process of a path towards elimination? We have a slightly different situation in Trachoma in the sense that the WASH component is an integral part of the Trachoma strategy for elimination. And so what we've seen is quite a lot of innovation and creativity in Trachoma partners being able to still support health ministries over the last 6-7 months with hand washing, with access to water and sanitation to help support risk mitigation for COVID-19. But we are being presented with a whole new landscape, on a political side, policy side, health program financing side, to understand how do we support health ministries to resume NTD activities in this new environment. At this point, maybe I'll hand over to Angelia for some direct reflections on what's happening on the ground for Trachoma.
Yes, thank you. I agree with everything Aparna said, as I usually do. And I would add that it's absolutely increased focus on WASH because of COVID, sort of at the community level, and it highlighting sort of human rights in connection with access to water and these different things. I think the most important thing, and what I'm concerned about, because I've seen this in some countries that have had cholera outbreaks, there's this agreement, there's a lot of focus on WASH, you have a lot of organizations who come in, there's a bunch of money, a bunch of education, and then as soon as the cholera outbreak is contained, everybody leaves. And I think it's important that we just recognize that at the heart of most of the diseases is water and sanitation. It's just, we continue to have that message reinforce that WASH is one of the most, really in my opinion, the most important aspect when it comes to overall health. And so as we move forward, we can't let that, the difficulty of measuring behavior change or the difficulty in triggering behavior change cause us to continue to ignore programs to really focus on WASH as both prevention and treatment aspects with diseases.
Brilliant. And we've had a comment from Martin Coleman, who's first of all saying thanks both for the presentation, and also I'll read it out. Martin writes, maybe it would be good to explain the ICTC transition documents that specifically target the mainstreaming of Trachoma work within strengthened eye health and general primary health care. I have posted a link to the ICTC website to all our attendees, and you will find there a tab also with the ICTC resources library. So I'm assuming a lot of what Martin's referring to may well be in that section. So by all means, do go and consult this. I am not surprised that on World Sight Day and with this wonderful presentation you've given us, there are a lot of questions pouring in. I'm just aware as well that we're coming up to about 60 minutes. So I just wanted to ask you both whether you might have time for 1 or 2 more questions, or whether you need to move on. Understandably, it's a big day for the ICTC on World Sight Day, but if you do have time, perhaps we'll try and squeeze 1 or 2 more in, if that's okay with you. Yeah, it's been just simply a great discussion. I think kind of building on what we were just talking about, and this is what you mentioned, looking ahead, kind of next steps. You both were talking about the last mile and the sort of remaining pockets of disease. I'm assuming, like in many NTDs and other diseases that are sort of on the out, those pockets tend to remain rather resilient and persistent. And so we were just wondering how will you go about perhaps to reach out to those vulnerable populations? They are, as you quite rightly said, presumably sometimes very remote or nomadic, and also do you feel that there will be a lot of opportunities for countries to really back that effort, given that these may well be in war-torn areas or within refugee settlements, which sort of bring their own political problems anyway? So how do you see the future of the last mile, and what, since we do have a captive audience here, is there anything that other partners or that academics worldwide could do? Are there still gaps remaining to achieve those successes in the last mile?
Well, there are so many gaps. But Angelia, I wonder if now's a good time to kind of pull in some of the pieces from the NTD NGO networking cross-cutting group on conflict and humanitarian emergencies. Oh, you're just on mute, I think.
I was just thinking that I need to, once you start talking, I'll put the link. Yes, I think there is a growing, over the last few years, there's been an increased awareness about different populations. We'll call them special populations, or which can include multiple groups. Those who have been displaced for whatever reason, conflict, natural disasters, those things, ones that sort of fall outside our traditional model of providing interventions. And the nice thing is that, well, first, I think the thing that we have to adjust our mindset to is we very much have been thinking about programs in a geographical setting. So the Uganda program or this district's program, because we measure things based off of what is the prevalence in this district among this population. We measure success for the elimination based off of what the country achieves. But diseases do not just affect a geographical area, they affect populations. So when those populations shift, we have to shift with them. And that may be seasonal shift. It may be shifts because of displacement. So how can we adapt our programs to move with the people versus just operating within defined boundaries? And over the last few years, the NTD NGO network, the NNN, or I might have swapped those, has a working group looking at conflict and humanitarian emergencies, specifically as one of these groups, these subgroups, or thematic groups, and putting together sort of resources of what to think about if you're going to be implementing programs in these contexts. So what are things that you need to do in order to provide services in a refugee or IDP camp? Who are the people that you need to talk to? Things that you need to think through in order to be successful. So I will put that link into the chat. That may be very interesting. And then that sort of toolkit then has resources that you can look for other organizations that provide additional information.
Brilliant. We also had quite a few technical questions. So we have colleagues asking whether trachoma, Emmanuel Agunloy is asking whether users of contact lenses may be prone to trachoma infections. We also have colleagues asking about open defecation and sort of including that into prevention programs, which I'm sure has been done quite at length. Also a question about software or an app to help with trachoma care, and I'm assuming that Tropical Data, that platform, might be very helpful in that there was a huge amount of technology actually involved in eliminating trachoma, and that probably gave a real step shift to the mapping and to a better understanding of the disease. So a lot of those technical questions maybe we could email to you subsequently, but just kind of going on the technical side of things. Is there more technology that you would like to see developed out there? Maybe also there is a huge amount of data now that's been gathered, and that's brilliant, but maybe, you know, it's a lot of data and something else could be done about that? And with that, looking forward, what would kind of be on your wish list, again, to tackle this last mile technology-wise?
Yeah, I think the questions are very good, because it's interesting. With success, as trachoma reduces, it presents other challenges. So once, before, when you would train someone on how to identify trachoma, it was very easy to give that person in-field training because there were so many people that you could use as examples. But now, as countries are reaching their targets, which is what we want, there's fewer people there to provide that sort of hands-on training on what to look for, or to maintain those skills. Before, if you were a surgeon and you were doing hundreds of surgeries a year, you're maintaining those skills. But now, if you've started to reach the elimination targets, you may only be doing 2 operations a year, which is what you want. But when it comes to skill development, it makes it a little bit challenging. And I think the trachoma community has been very good at leading on research in order to address some of these issues. So whether it's technology in order to record patient data, there's also Head Start, which was this very cool sort of head mannequin with eye cartridges that could be removed that allowed surgeons to practice their skills. And because it wasn't a live human, you could then take out the eye and look at the back of the eyelid to see what your sutures looked like. And that was developed years ago. And now it's becoming very useful as surgeons in order to help maintain their skills. So it really ranges from the technology side, taking pictures when you do surveys in order to have the pictures graded remotely, as there's fewer and fewer people that may have that skill, just because, again, it's not a lack of people wanting to have the skill, there's just less and less trachoma. So you develop technologies kind of based off where you are on that last mile, and it's been very interesting to see the challenges that are presenting themselves.
Brilliant. So for the person who has it all at Christmas, there's always this great device you mentioned.
Which is great when you go into a country and it's in your suitcase at customs.
Oh yeah.
Bunch of eyeballs. Just look at you.
Why not? I'm sure they've seen it all.
And just to reiterate, some of these resources, things like training with Head Start, these are all resources that are on the ICTC website as well. If you go to the resource library, alongside ICTC's preferred practices around conducting training for drug distributors, surgeons, supervision, as well as these transition documents or toolkit that Martin mentioned. So just quickly going back to that, last year ICTC's members and observers came together through a series of workshops to have a series of discussions around bringing together a toolkit that would support program implementers to essentially transition from elimination into routine public services. And that was recognizing that a number of these transitions might take place through different spaces. When we look at interventions like TT surgery, for instance, it was recognizing that we would need to transition training or the capacity to undertake TT surgery no longer within trachoma programs that will be disbanded once countries reach elimination, but how do we include training or upskilling for that service, but within the eye health service. So, what were the opportunities to collaborate and coordinate trachoma interventions back into national eye health units so that surgeons who are doing cataracts, for instance, could also be trained to do TT surgery as and when cases presented. And then we have other transition toolkits looking at drug distribution, but also around facial cleanliness and environmental changes. The F&E component is quite interesting because there is no one singular entity or place that you would then ask people to then continue WASH services. And I think, as Angelia reflected on, given how WASH and access to clean water, sanitation, and hygiene is a fundamental core to so much of what enables good health, it the transition document really emphasizes on close collaboration with the WASH sector, not just halfway through a program or at the end of a program, but really considering how the WASH sector is an integral partner, and how working with them helps to ingrain these opportunities, these services, these interventions, not just with the WASH sector either, because it's not about handing over responsibility from one program to another. It's about how do we achieve coalition or partnership buy-in that everybody sees their responsibility in supporting good health through these interventions. And so again, you can find those through the resource library on the ICTC resource library website. And additionally, Marianne will be happy to compile a few quick links to some of the resources we've mentioned today, including on the NNN piece of work on conflict and humanitarian emergencies.
Absolutely brilliant. And there's an interesting comment here from Professor Majid Harandi from Iran about repurposing those skills and kind of looking at eye health in a more holistic way in countries. Majid writes that one major parasitic cause of vision disorders in low and middle and high income countries is acanthamoeba keratitis, particularly in contact lens wearers. Has ICTC dealt with this issue? I'm sure that there's plenty there to explore in terms of partnerships. And so perhaps just to conclude sort of this session, and I just saw on our Twitter feed, actually, at ISNTD Press, Dr. Maganga Sambo, who's a researcher at Ifakara Health and IBAHCM, is saying there are plenty of transferable lessons for rabies elimination, particularly speaking to the cross-cutting elements in your presentation. And so just to conclude our session then, what, in your opinion, what other neglected tropical diseases can best be targeted by your model of very successful partnerships that you've developed at ICTC? I'm sure lots of partners in other diseases will be looking at you with, very envious eyes and sort of trailblazing this immense success in reducing the burden worldwide.
I think it's safe to say that there are no easy or quick wins when it comes to partnership building, because essentially partnership building, coalition building, all relies on individual relationships. And the strength of any partnership is based on the level of trust and ability to work together in collaboration. And I think the Trachoma community is just one example of a partnership that has really focused on those one-to-one individual relationships, not just with other endemic health ministries or with each other as NGOs, but really forging a strong communicative relationship with donors as well, to understand how to coordinate the way in which donors work together with other partners. And there's no easy way to do this. It requires time and effort and relationship building. It requires a lot of navigating of politics to be able to reach consensus, to be able to navigate differences of opinion. But as you can see from examples like progress in Trachoma, there is so much to be gained from being able to invest in those partnerships and those relationships, if it means an effective coordination mechanism that ensures the success of national programs.
Fantastic. Angelia, any concluding comments?
No, I just think coalitions are as strong as its members and those who are willing to invest the time and in it. And we're very lucky that it's made up of members who feel very passionately about this and who continue to support the work and continue to be creative in finding solutions to problems. And we are learning from other coalitions, and we're constantly hoping to share our experiences with others as well, because we're all trying to achieve very noble things. We all want the communities that we live in to be healthy, and it's a good thing.
Absolutely. Well, on that note, on this World Sight Day, thank you so much, Angelia, Aparna, for your time. Thank you to all our attendees for tuning in today. The session will be available as a recording. If there's anything you would like to listen to again, or perhaps watch the video again, it's all available on our YouTube channel. Please don't leave the webinar without going on the chat and exploring lots of really valuable links to a huge amount of resources that have been posted by Tinja Suderson from ICTC, myself, Aparna, Angelia has also just put a link there about NNN resources. A hugely important day. As you can see, all three of us wear glasses, so we take this cause very seriously. And on that note, I'd like to thank you all for getting together today, and hopefully looking forward to seeing you both very soon, Angelia and Aparna, and to our attendees and audience next week for the next ISNTD Connects.
Wonderful.
So,
Thank you.
on that note, take care, keep safe, everyone, and we'll see you very soon.
All right. Bye.
Take care. Bye.